So I'm just going to talk a little bit about our Masters in Primary Care, which is a brand new course, and this is with a special interest in mental health care. So just going to speak a little bit about why you might be interested in doing a postgraduate course in primary care. We'll go through the structure of the program. I'll run through the fee structure and then talk a little bit about the details within the modules. So why, some of the reasons to do a postgraduate in primary care. So it's of interest to a number of different kinds of clinicians, doctors from lots of different specialties, GPs and allied health professionals who have a special interest in mental health care. It's obviously a university level qualification and recognition of any special interest you might have in this area. And the idea would be that it will improve the interface between primary and secondary care, which, as we know, is always an area where it can be a little bit challenging for us in terms of communications. So hopefully it will lead to improved care for patients and ultimately reduced waiting times for any interventions, which in the area of mental health is obviously really important, and potentially an added revenue stream for people. So why this particular course? So it's been designed for online delivery, so it should fit in with a busy clinical schedule. There's initially planned to be 2 to 4 practical days each semester, but with restrictions, we might have to do these online, and that's certainly what we're planning to do at the moment. But obviously we will be able to see going forwards how that's going to work out with public health advice. We've got some really well-known and established specialist contributors to the course, and I'll introduce them a little bit later in this presentation. This should be really relevant and applicable to your daily work in primary care. It's a recognised qualification from UCD, really good for your practice development and your career development. And then hopefully, when we're allowed, we'll obviously have access to UCD student resources, so campus, library and gym. So this is just a little breakdown of how the course is structured. In the first year, we've got, starting in autumn, in September, we've got the specialist module, which in this case is Mental Health Care 1. That's one of the core modules. And then alongside that is the research module, which introduces you to how to manage research and preparing you for being able to write a dissertation in the second year. Then following on from that, in the second semester in spring, so from January 2021, you'll be doing your second specialist module in mental health care, and there's also a primary care module. And that kind of completes the first year. If you do 3 out of the 4 modules in the first year, you can exit with a graduate certificate in primary care. And then going on into year 2, we've got the clinical placement, which is your specialist module 3, so mental health care 3. And if you've done all 4 modules in the first year and then this clinical placement module, you can exit at that point with a graduate diploma in primary care with 60 credits. And then the last part of the master's is the dissertation. And that's worth 30 credits. Now, so just going into a little bit more detail on that, what we were just talking about. And then a little bit more just about the clinical placements. So there's going to be, we're going to break it into 2 weeks, hopefully, or 10 8-hour days. In mental health care, what we've arranged to do is 2 days or 16 hours in each of these 5 different rotations. So Irish Town Primary Care Centre, where our lead clinician works. Then in adult general psychiatry, outpatient department, liaison psychiatry, old age psychiatry, and in the emergency department. Then going on just a little bit about the dissertation. So you'd undertake to enact and disseminate an original piece of research based on your own work and clinical environment. So it should be relevant to your practice. And this will hopefully develop skills like enhanced critical thinking, analysis, problem solving, and improving your patient care through clinical audit and quality improvement. So this is our lead clinician, Professor Elise Guarandil. She's a consultant psychiatrist and also a clinical professor in the Department of Psychiatry. at UCD and in St. Vincent's Hospital. There's a little bit of information there, and you can find out more about her if you're interested on the website, and I'll give you that link in just a moment. So she's helping coordinate our program. Then our other sort of lead contributors would be Dr. Susan Moore, who's a consultant liaison psychiatrist at St. Vincent's. So she works on the the link between physical and mental health. So she'll be directly involved in teaching on the program. And then Dr. Bláthnaid Gavin, who is a child and adolescent psychiatrist and an associate professor at UCD. And she is well known for her work in ADHD and children's mental health. So then Professor Walter Cullen, who is the a general practitioner and the professor of urban general practice at UCD. So he's involved in developing the curriculum and will be involved in teaching as well. And then lastly, myself. So I'm a GP and I have an interest in medical education and pre-hospital care. And I'll be helping on the course and coordinating the syllabus and the curriculum. This is our website, the School of Medicine website, and it has a whole lot more information about the course. So I've put the link there at the bottom, and you can explore there and find out more about everything. Just a little bit about the fees then. So this is for EU graduates, and you can see there that the graduate certificate comes in at 4,200, the graduate diploma 8,400, and the full MSc is 12,600. And these are payable in installments. There's full details there at that web link there at the bottom. We do have some recognition of prior learning. So if you have got previous qualifications in the area of mental health care, then you may be eligible for reduced fees and for the credits that you already have. This will be done on a case-by-case basis, so it's just a matter of mentioning it when you apply. So a little bit of detail on the modules and the breakdown of the content. So about 70 hours of online content. Webinars are for 1 hour every week. The modules are arranged such that you have alternate weeks for each module. So you'd have your mental health care webinars on I think it's the even weeks, and then on the odd weeks, then you have your research module in semester 1, for example. The practical days would be 8-hour days, and there's 2 of those in the semester. And then the reflective clinical practice element is obviously taking what you've learned and using it in your own environment, and bringing that back in then to the group. There'll be a certain amount of group work, some self-directed learning, and I think that's kind of covers that. The primary care components then, so these modules are common to both the Masters in Mental Health Care, and there's another one we're doing which is in Orthopedics. So in the first semester, you've got your research module, Research Methods and Scholarship Enhancing Clinical Practice. And then in the second semester, a primary care module on contemporary issues in primary care and general practice. So just a little bit about the research module. You'd be taught how to conduct a literature review, assess and explain evidence, designing clinical audit, collating, managing data, producing a quality improvement project that's relevant to your clinical work, understanding approaches to research. Obviously, being familiar with research ethics is really important. And basically successfully completing your research project and using that for your day-to-day work and conducting regular case reviews using reflective practice techniques. The primary care module in the second semester is going to have a look at the latest developments in managing and treating common conditions that affect patients in primary care settings. So we'll have a series of webinars on different core topics by expert contributors, including things like public health, pharmaceutics, endocrinology, neurodiversity, quality improvement, chronic diseases, which is obviously very relevant at the moment, and case-based scenarios. So that's the end of the presentation. My email is there, Sheila Loughman at ucd.ie, and the primary care medicine at ucd.ie will bring you through to Sinead, who administrates our programme.